A comprehensive set of digital support channels has been launched for healthcare professionals fighting against the COVID-19 pandemic. There will be ongoing interaction with healthcare professionals through mobile and the web to allow institutions to better understand the key issues facing those on the front line. We're joined by Dr. Yaseen Khan, who is the CEO of EM Guidance. Dr. Khan, good evening and thank you for your time. Firstly, just explain exactly what this portal is and how it will work.
Great. Thank you very much, Kathy. So just a word on the platform first. Essential Medical Guidance, or EM Guidance, is a digital healthcare platform. It's used exclusively by South African healthcare professionals, so doctors, nurses, pharmacists, and so forth. And what it does is it provides them with a range of clinical guidance, guidelines, medicines content that's useful for working in the front line in the South African health system. And we do this across board, across the range of medical conditions. We work closely with the National Health Department and various other academic institutions to really empower frontline healthcare workers. And the mobile platform already reaches more than 50% of the local healthcare community, and really sort of every town, every small town and city around the country. It's free for healthcare professionals. And the way the business works is we actually connect medical companies and industry to digitally connect with the health force through the platform. So very much sort of an open access platform designed to support healthcare professionals. And hence, with respect to COVID, what we've done is really leverage the platform and released what is a comprehensive set of COVID information support channels, which are really based upon a survey we did with the local audience, with over 3,000 healthcare professionals from the ground, saying that they've got issues with personal protective equipment and mental health care and emotional state and other clinical information needs on the ground. What we've done is very much created a set of easily accessible two-way channels, which allows the health force to connect with information and support from a range of partners, including, Business for South Africa, the healthcare network, a consortium of mental health care institutions, and obviously government content and so forth, really having access to everything they need in one place.
When it comes to the kind of difficulties that health workers are having in fighting this pandemic, how accurate is the data that you are getting from them? And, what are you able to do with it? So outside of, linking them up with partners who might be able to alleviate some of the PPE shortages, to what extent does this information also land up in the hands of the state?
Yeah, so we have a very direct connection with the healthcare professionals that use the platform. And the information, we got really really demonstrated some strong trends on the ground. I can share some of them. The predominant emotion was anxiety, and this was predominantly among younger doctors, but it was also across the state and the public sector. From a PPE perspective, the N95 mask was really the most sort of needed requirement on the ground. So we get the information as is, and we can see the trends as they are. Certainly, there are other sets of information as well, and ways of qualifying what exactly is going on the ground. But this is very real, and it's very real time. And we work with the various partners to try as best we can to meet those needs through information and support.
And how are doctors then getting help and treatment for some of their own anxieties and fears about living in this moment like the rest of us, but of course being at a much higher risk than the rest of us might be?
Yes, it's a really difficult time for healthcare professionals. Their lives are, to a degree at risk. And one of the things that we've implemented in the mental health support channel is really tapping into the healthcare workers network, which is a consortium, led by the South African Society of Psychiatrists and various other mental health institutions. One of the things they can actually do is access professional mental health care support within a certain time period directly from the application. And furthermore, one of the other things that can be done is we will be consistently using the platform as a kind of two-way channel to do these kind of pulse checks of what the sort of mental state and needs are on the ground, and continuously feeding that back up. And what we can then do is really develop and push content, educational material, and other kind of support services that we can sort of undertake digitally, and really support along the lines of what we're learning on the ground.
Certainly.